for nasal delivery of apomorphine. So in this study, in this talk, I will talk about the synthesis and the in vitro evaluation. So let's start with the introduction. As the, I think, okay, we are all most of the pharmacists, so we all know the Parkinson's disease. So in this slide, we show in healthy patient, the dopamine is produced in a sufficient amount from the nerve cells in the brain. But in the case of the Parkinson's patient, the dopamine production cells are die or malfunction. Therefore, the insufficient amount of dopamine is happen in the case of the Parkinson's patients. Therefore, with this lack of dopamine, resulting in the movement disorder, which is including the blank facial expression, forward tilt to posture, or bradykinesia. Of course, to treatment Parkinson's disease, giving the dopamine is the drug of choice. But although, for example, the levodopa is a drug of choice, but although the drug is given at the appropriate dosage, there's still some on-off phenomenon happen in the patient. Except in this case of this drug, it's apomorphine. Apomorphine is a dopamine agonist, which is mimicking the action of dopamine. It's used for treat the off effect because it's rapidly and consistently reverse the off effect phenomenon. Therefore, this apomorphine, it's helped to improve the symptoms when the off episode has already begun. But the apomorphine itself, it's rapidly degraded in the gastrointestinal tract and highly affected by the hepatic first pass effect. Therefore, given this medicine or this drug, by the oral, it has only around 2% of bioavailability, and given with a high oral dose, resulting in the gastrointestinal complications and also related with the nephrotoxicities. And this product is at the moment available only in the parenteral form, so it's also not that convenient for the patient to have it for this route of administration. And it was reported that nasal drug delivery is shown the same efficiency as the injection or parenteral because it's offer the rapid absorption, and in the nasal mucosa there is a highly vascularized. Therefore, the drug is absorbed directly to the blood vessels, and it can avoidance of the hepatic metabolism. And especially this route is offered the nasal to brain delivery route, which is quite special for this case because this dopamine is insufficient in the brain. However, with this route of administration, there's still some disadvantage. For example, the local irritation, maybe from the molecule of the drug itself, or we also can solve this problem by the formulation. And another disadvantage is the presence of the mucociliary clearance in the nasal mucosa, which is going to remove the drug from the site of absorption. Then the drug is no longer anymore there. So as he already mentioned, that thiomers, it's effective for mucosal drug delivery. So thiomer is mainly composed with the polymer backbones, and we connected with the thio groups, and then we call thiolated polymers or the thiomers. With this presence of the thio groups, when this polymers is in contact with the mucosa, for example in the nasal mucosa, the sulfhydryl groups from the polymer backbone form the disulfide bond with the thio groups, which is the component of the mucin. And with this attach of the sulfhydryl groups, we found that the mucoadhesive property is improved. Therefore, this kind of polymer could prolong drug residence time at the site of absorption. However, this type of polymers, it still provides some disadvantage because this polymer is subject to the thiol oxidation at the pH above 5. Therefore, it forms the disulfide bond in itself. And in the nasal mucosa, the pH is around 5.5 to 6. Therefore, we introduce the pre-activated thiomers. So we add the thiol-bearing groups next to the thio groups to protect the thio group before it reaches the site of absorption. Therefore, this leads to my purpose of study is to investigate an improvement of apomorphine absorption in vitro through the nasal mucosa by co-administration with our newly synthesized pre-activated polymers. So I first start with the synthesis of polymer. I use the polyacrylic acid, which is already reported for the mucoadhesion. And first, I made the reaction by activated carboxylic moiety with addition of this EDAC. Then the cysteine was added, and the reaction was run for 3 hours. At the end of the reaction, this reaction mixture was dialyzed against acidic condition and lyophilized to get the cross-link thiomers. Then the thiomers was further pre-activated with the dithiodinicotinonic acid to get this structure. And I do it with the different degree of pre-activation. So with a high degree of pre-activation, the DMSO was added to help to improve the solubility of these dimers, and the pH was adjusted to 6. And in the medium degree of pre-activation, the DMSO was omitted, and the pH was adjusted to 7 or 8. Then, of course, the reaction mixture was lyophilized later on, and then we got the polymers. So after we got our polymers, we do the characterization by determination of the total thiol groups and the free thiol groups. So in the first column is the total thiol groups, also in the form of free thiol and the disulfide bond. So in the case of the control, as the EDAC is omitting, there is almost none thiol. And then in the case of thiomer, this one, all the thiol groups, it's in the free form. But in the case of the pre-activation, 2/3 of the thiol groups, it's in the free form, and the rest are in the, 1/3 is in the free thiol groups, and then 2/3 is in the, it's in the disulfide bond, and with the high degree of pre-activation, lower amount is found in the free thiol, in the free form. And the conjugated 2-MNA was also determined. So with our synthesis method, we have 67% of pre-activation for the medium degree and 82% of the pre-activation for the high degree. So after we got these polymers, we do the in vitro test, the permeation of apomorphine in the presence of the polymers. The experiment was done through the freshly excised porcine nasal mucosa. Apomorphine has been used at a concentration of 0.5 milligram per ml, and the tissue was fixed in the Asing chambers, and we do the experiment across this mucosa that fixed in the mid of the Asing chambers. The experiment was done at the pH 5.5 at 30 degrees Celsius with the presence of 5% carbon dioxide aerated. The sampling time was done at the 4 time points at time 0, time 60, 120, and 180 minutes. At the end, all the sampling were determined by the HPLC. So in these figures, it showed the cumulative amount of permeated apomorphine. This result indicated in the presence of our newly pre-activated thiomers in both cases with the high degree of pre-activation and the medium degree of pre-activation. Apomorphine permeation is higher than the control, which is a solution, or it's even better than the thiomers. And in addition, the degree of pre-activation is also show an impact on apomorphine permeation, because higher degree of pre-activation improved the permeation to 3.4-fold higher than the control, and in the medium degree of pre-activation is 2.7-fold higher than the control. Regarding my results, so this we can conclude that the high degree pre-activation of thiolated polymers could be of pre-activated thiolated polymers could be considered as a promising excipient for the nasal apomorphine delivery. So, last but not least, I would like to acknowledge the Technology Grant Asia, financed by Austrian Federal Ministry for Science and Research, for supporting my study in Austria. Thank you very much.